I will be discussing the topic on demerits and adverse effects of smartphone uses in NICU under moderatorship of Dr. Akansha ma'am. So we will be discussing the topic under headings of introduction. What are the demerits of smartphone uses in NICU and how they cause bacterial contamination and how this can be prevented. What is electromagnetic interference, equipment malfunction, effect of noise and take-home messages. So coming to introduction, worldwide 5.07 billion smartphone users are there, out of which India inhabits around 1.2 billion users, and 90% healthcare workers, they use smartphones because it is very handy in exploring information at point of care. Now coming to demerits. So apart from source of distraction, the most important demerit is compromise in aseptic environment. Then interference with NICU equipment is a source of electromagnetic irradiation and it alters noise level in NICU. Coming to side effects, which can be broadly divided into infectious and non-infectious causes. And non-infectious causes, as we already have discussed, include equipment failure. It's a source of irradiation and source of noise and distraction. So coming to infectious causes, that is healthcare associated infection. So basically the smartphones can be considered as third hand because they act as reservoir and surface station for a wide range of both commensal and pathogenic bacteria, viruses, fungi and bacteriophages that inculcate multi-drug resistance within the bacteria. And there are various studies in both adult as well as pediatric population regarding the organisms that are isolated, and in most of the studies, most common organism that was isolated was corns. However, basically it depends on local flora and hand flora of healthcare worker, but one thing is common to all these organisms, that is high virulence and multi-drug resistance. So coming to healthcare associated infection, these are the two images showing this is one can see how the load of bacterial colony count from a surface cell culture that is collected from smartphone surface. So this is the evidence of amount of germs or bacteria that live in the surface of a smartphone. And the right side of the image shows how pre and post cleaning culture plate differ. So one can see that post cleaning the colony count has almost been reduced to zero. Coming to different types of organisms that are isolated. So this was a systematic review that was published in Journal of Neonatal Nursing in 2018. So they have compared 5 different studies, and most common organism that was isolated from smartphone cell culture was again corns. Loyola et al. Did a study in 2016 where most common organism that was isolated was Enterobacteriaceae. And in a study done by Doherty et al. In 2017, most common organism that was isolated was corns, followed by Klebsiella and E. coli. Again, basically this depends upon the local flora of NICU and hand flora of healthcare work. So coming to viruses that are isolated, again smartphone culture, they harbor a large amount of both pathogenic and non-pathogenic viruses, including CMV, Epstein-Barr virus, HSV, Roseola virus 6 and 7, and polyoma viruses. This was a recent article that was published in Nature 2022. That was mobile phones are hazardous microbial platform warranting robust public health and biosecurity protocols. So in this article, they have shown that apart from cons, smartphone surface, they act as reservoir for various gram-negative organisms, specifically the escapem group, that is an acronym for Enterobacter, Serratia, Citrobacter frundi, Aeromonas, and the Proteus group, that are Proteus, Providentia, and Morganella. And these Proteus group are known to carry intrinsic resistance to even cholesterol. Then Hasek group of organisms, Stenotrophomonas maltophilia, and a wide range of bacteriophages that cause multi-drug resistance within the bacteria. And even in this study, the MR cons that were identified were resistant to vancomycin. Coming to organisms that were isolated in Indian setting, This was a study from Tertiary Hospital of South India that was published in Asian Journal of Pharmaceutical and Clinical Research in 2016. Again, most common organism that was isolated was cons, followed by commensals like dipteroids, and they have shown that various fungus like Candida and Aspergillus also inhabit smartphone cell surface. Coming to effects of hand hygiene. So this was a study that was done by Beckstrom et al. In 2013 on the culture positivity rates pre versus post hand hygiene. So post hand hygiene, the culture positivity rates decreased to 26% versus 96% pre hand hygiene. So coming to most important aspect, that is prevention. So basically prevention is remove the source or eliminate the source, that is restrict cell phone uses in NICU as far as possible. And then one should use 99% bacteria-free alcohol wipes that contains around 75% ethyl alcohol to clean outer surface of smartphones. Then one should place it in clean bin that should be placed outside NICU. Then healthcare workers should use a hand sanitizer post texting or touching smartphones. So these are the images. So every NICU should have a dedicated area outside NICU so as to keep this smartphone. After cleaning, this should be put in a container or bin. Then every NICU should, outside NICU, there should be posters on cleaning smartphones so as to enforce this action. Then on right side of the image, these are the alcohol wipes that are commercially available, which contain around 75% ethyl alcohol to clean the smartphone surfaces. Now coming to other non-infectious side effects, which include electromagnetic radiation. So in today's era, the smartphones, they use basically two different types of technologies, that are GSM and GPRS, which use frequency within the range of 800 to 900 megahertz. And basically the amount of electromagnetic irradiation or the exposure depends on three things. What is the amount of electromagnetic radiation that is being irradiated from a smartphone? Then what is the distance from cell phone? And whether or not the cell phone is in standby mode. So this was a systematic review that was published in the Medical Journal of Australia way back in 2004. And in this study, they have compared different devices like ventilators, infusion pumps, and monitors for electromagnetic interference. And electromagnetic interference was defined as a change or interruption in volume delivered, say volume delivered by infusion pump, or change in ventilator settings, or change in alarm limits that was set in a monitor. So out of 479 devices, they have shown that 45 out of 479 devices showed clinically relevant electromagnetic interference at 900 megahertz, and 14 out of 457 devices showed EMI at 1800 megahertz. So from this study, they showed that the EMI or electromagnetic interference was more at lower frequency. Then most clinically relevant EMI, it occurred when mobile phones were used within 1 meter of medical equipment. So what should be the safe distance? Smartphones should be restricted in NICU as far as possible, and if at all they are being used, the current safe distance for the use of smartphone is said to be 1 meter from a device. Then what should be equipment standard? According to United States Food and Drug Administration, medical equipment should be immune from interference in field of up to 7 volt per meter within a frequency range of 450 to 1000 megahertz. And this can be cross-checked during purchasing instruments. Coming to equipment malfunction, although a wide range of equipment that are used in NICU can be affected by electromagnetic interference, but three most important equipment that can alter patient outcome include ventilators, infusion pumps, and monitors. This was an article that was published in Indian Journal of Critical Care Medicine in 2008. It was effect of mobile phone use on specific intensive care unit devices. Again, they have compared these three devices only: ventilators, infusion pumps, and monitors. So they have shown that EMI occurred while using the mobile phone in vicinity of an infusion pump, And in this study, they have shown that mean variation in delivered volume by syringe pump was around 2.66 ml. There are various case reports on equipment malfunction. So this was a report that was published in Lancet. So what happened? An 18-year patient was diagnosed to have septic shock and was being treated with epinephrine infusion. And later on, according to clinical condition of the patient, the epinephrine infusion was escalated. But later, the patient developed symptoms of catecholamine excess, and eventually the patient succumbed. And retrospectively, the hospital team investigated and found that it was due to use of mobile phone in the vicinity of the particular syringe pump, which triggered its malfunction. And later on, they confirmed it by using smartphones at varying distance from that particular syringe pump, which was set at 30 ml per hour. And during several test calls, the syringe pump or infusion pump spontaneously delivered at the rate of 999 ml per hour. So one can see from this case report that how smartphone use can lead to dreaded complication. So coming to effect of noise, this is non-specific side effect that is common to any device that is a source of noise. So starting from, it can cause, in neonates, it can cause crying, hypoxemia, tachycardia, apnea, hearing impairment, impaired growth and development, dreaded complication like raised ICP and intracranial hemorrhage, disruption in development supportive care, including sleep deprivation and disturbances, alteration in physiological and behavioral milieu. So briefly, these were the some demerits and side effects of smartphone use in NICU. So coming to take-home messages, most important aspect is to maintain asepsis. So restrict smartphone in NICU as far as possible, and one should always perform hand hygiene post texting or touching smartphones. And healthcare workers shall clean smartphones with alcohol-based swabs and put smartphones in silent mode while in NICU vicinity. Thank you.